You're listening to Improv-ing Business, where personal and business finance take a front row seat. I'm Brandon.
Hello, this is Rick.
And today we'll be talking about what a small business should know about employee health care. If you're a small or mid-sized business owner, you have to possibly give your employees health care.
Yes.
Depending on
big expense.
Big expense. Especially if you're not using independent contractors, which most of the time you shouldn't be, because the IRS slammed down on that a couple years ago.
Yeah, be careful of that.
Not only is it important for small business owners, it's also important for your employees. It's one of the biggest expenses that people have monthly, and it's one that can definitely take a lot of stress off people's minds, knowing that they have adequate health care.
Uh-huh.
I mean, the joke about America is that only in America can you have Breaking Bad. Because if it was in Canada, it would have been a 30-minute long show. Walter White, you have cancer. It's completely covered. Breaking Bad.
Yeah, right.
Final credits.
Oh, you're right. That wouldn't work.
Nope.
I didn't think of that.
Specifically, though, if you're a small business that'll have 50 or more full-time employees on January 1st of 2016 coming up, then the insurance mandate may apply to you.
Mm-hmm.
But you're wondering to yourself, where do I start? How do I do this? I've never done this before. The mandate is new. I never covered me before. Who do you call, and
Who are you going to call?
who are you going to call? Insurance company. Basically we'll be talking about this episode. What we have tips from one of our insurance providers who does all of our family insurance, talking about what you need to do to get covered by this mandate.
Yeah, Deborah Destephen of Farmers Insurance in Torrance is one of the people on the team that I work with our clients on health insurance, small businesses. So we're going to be talking about how you can set up a team and what kind of questions you should ask. So the story today that we're talking about healthcare is something that is very close to my heart. Actually, about 6 inches, I guess.
Yeah, not very far at all.
My thyroid, or what's left of it. So I had half of my thyroid out because I had this little growth on there. And I had a series of doctors, my primary physician, who then sent me to an endocrinologist, who then sent me to a surgeon. So I got a team of 3 people. But what I learned is that they weren't communicating. The particular system that I'm involved with, a private hospital system here where all these doctors are tied in, they really aren't talking to each other.
That's worrying.
Well, they're supposed to be sending faxes of the reports and the results
because
of
it's
surgery.
1990.
And they weren't. and so I go back to my primary physician for a pre-op, and he said, "So how did your biopsy come out?" I said, "Don't you know? It was like 3 weeks ago."
Yeah.
I said, "No, nobody tells me anything." And so this is a good example of when we're talking about healthcare and your employees, is that you really want to get them into a good system.
Yeah.
What I did find out is that my wife, even though we have the same insurance, belongs to another hospital system, UCLA. Not only does she have her doctors getting her reports and results through the internet.
Oh, wow.
Through a database.
Yeah.
That they all tie into.
So they don't use carrier pigeons like yours does?
That's right.
The fax.
I know. They get stuck somewhere in those smoke sacks on the Hyperion sewage treatment plant. On their way over to our house.
They're finding a new life.
Yeah. But not only did she get those kind of reports between her doctors, but she also has an app where she gets all of her reports, all of her medications, all of her appointments, everything on her app.
Wow.
Automatically.
That's great.
I know. And it's like, okay, I'm leaving this system. This is crazy.
Yeah. The last time I went to a doctor, they were still using paper.
Really? Paper?
Paper.
Oh.
You may have heard of it.
Papyrus.
I sound like that guy from Waterworld. Paper. No one knows Waterworld.
So, when you're looking for a healthcare system, you got to ask these kind of questions. Is that how do doctors communicate? That's very important because you and your employees are very in tuned to what's happening with your bodies. and you want to know that the doctors are in tune what's happening to your bodies. So this was not a very good experience for me. But if that wasn't bad enough, after the surgery, my surgeon talked to my my endocrinologist. That's the number 2 person in this chain. Okay?
Yeah.
And so
Broken chain.
Yeah, my broken chain. That's right. Chain of fools. Right. No. And so I had the meeting with my endocrinologist, and your mom came with me. And so the endocrinologist says, well, it looks like we have here your tumor was 3 centimeters by this and this and that and this and that. And I said, yeah, I knew that. And I said, yeah, I just want to know the lump that I have here in my throat from the surgery. I just want, it's kind of preventing me from singing. And I just want to know, how long I'm supposed to wait for this.
I paid the doctor extra to do that.
Thank you.
Put a lump in your throat so you can't sing.
Now, she had talked to the surgeon on the phone the week before.
Mm-hmm.
All right. So I asked her about this, about after the surgery, when is this supposed to be different? And she looked at me and she went, oh, you had the surgery?